Is heat a factor in mental health? That's a question that researchers, including some at the University of Massachusetts Amherst, set out to answer. And among the answers they found, rising temperatures have meant more suicides and mental health-related ER visits. For the details, I spoke with UMass Professor Jamie Mullins, the study's co-author.
When we came to start working on this, it was kind of from two different perspectives. We're interested in kind of thinking about trends going forward, and so my co-author and I were thinking both about, well, things are getting warmer as we're looking into the future, and then also if you look at the mental health data, what we see is that these negative mental health outcomes that we're interested in studying also seem to be trending upward. So in the United States, over the past 20 years, we've seen suicide rates climbing slowly, and it's a big problem as well when we think about issues that people struggle with mental health. And so about 4% of adults in the United States in any given year report having serious thoughts of suicide. And so this is something we care a lot about. We think it's an important issue, and we're interested to see how the environment might play into these issues, as well as what the implications going forward might be as we expect things to get warmer and warmer under climate change.
So as I understand it, some of the research showed that estimates showed increasing temperatures result in more suicides and mental health related ER visits. But why? Like, what's the connection there?
Well, so we wanted to get at not just one specific negative mental health outcome. And so we wanted to look at kind of what we call the spectrum in the paper. So we do look at suicide rates, and as you said, we find that higher suicide rates are associated with higher temperatures, outdoor temperatures. And then we find the same thing among emergency room visits for reasons related to mental health. And then finally, we look at a third outcome, which is people's self-reported kind of how have you been with regard to your mental health over the past month. And so these are three different measures that we think kind of characterize different levels of acuity of negative mental health. And we find across these levels the same association, which is as temperatures warm, we see higher rates of these negative measures of mental health.
And you were looking at a specific area of the country, right? You were working with a Caltech researcher, is that right?
So we're working, my co-author Corey White's at Cal Poly, San Luis Obispo. And we have national data for suicides going back about 50 years. The ER data is from California in the late aughts through 2018 or so. And then the survey data is from the 1990s through present day, but does cover the entire United States.
But the California ER visits, were you focusing there because you could look at more extreme temperatures, or why focus on California?
So the simple reason is that the data is available in California, but additionally, California represents a very large population with a very diverse set of environmental conditions. So that provides the opportunity to look at these sorts of impacts across a range of conditions.
And did you have the opportunity, or did the data report as such that you could look at whether age or socioeconomic background or some other factors changed who would be more likely to report these negative mental health happenings during rise in temperature?
Yeah, so we are able to do that with two of the data sets, both with the ER visits and with the survey data. And what we find is that these results are fairly consistent across demographic groups, across geographic locations, across kind of what we think about as baseline or normal weather or climate conditions, as well as a number of other factors that we may have thought would impact people's mental well-being generally, or the extent to which they're exposed to high temperatures in the outdoors.
So does that say that there's really no hope for the human race here in this? You know, air conditioning can't help, being aware that, okay, it's going to be warmer, maybe I need to be taking more self-care steps, things like that.
So we do find very explicitly that higher rates of air conditioning penetration do not moderate this effect. So we find that higher rates, as we've said, or higher temperatures lead to higher rates of suicide, ER visits for mental health issues, and these kind of just self-reported, I'm not feeling as well with regard to my mental health. And places that have higher air conditioning penetration, both at a given time and as air conditioning penetration rates increase over time, those rates don't moderate this effect. So basically the effects are the same magnitude, the same size.
Do you have any sense of why? It seems, air conditioning cools you down, does make you feel better sometimes, but it's not helping with that mental health piece.
Yeah, so we looked into this because there's some really wonderful research already out there looking at physical health and mortality, so deaths in particular, and air conditioning penetration, so deaths related to high temperatures. And they do find that higher availability of air conditioning reduces the negative effects of high temperature on physical health. So that's actually what we expected to find here. So it was somewhat surprising that we don't find that effect at all. And there's innumerable theories that you can put forward, but I don't have strong evidence for any of them. But we do show very convincingly, I think, that higher rates of air conditioning doesn't moderate this effect.
You said there are theories. Is there one that you think is of particular interest to you that could be plausible?
No, nothing really jumps to mind. I mean, it could be that it's not actually just the physical response of the body that's driving this, that it's kind of just an understanding of I'm uncomfortable, and that can happen whether you just have to go out in the heat for a while, or whether...
So as we move forward, obviously climate change is something we're talking about quite a bit at the government level, the activism level. If climate change were a problem that were solvable, perhaps, then this other factor that you found through your research could then be changed.
So I think what our research shows is that we need to be aware of the mental health implications of a warming climate, and that this is something that should be part of the conversation when we're thinking about the implications for an area becoming warmer or a country facing higher incidences of extreme heat. Additionally, I think that this research is useful for kind of planning the provision of mental health services. So some of what our results show is that people go to the ER more when it's hot outside. We don't show that whatever services they're receiving there aren't effective in helping them. So that at least shows that people on some margins are willing to seek out mental health services at higher rates when temperatures are higher. And so this is something that's important to think about when we're planning to provide or for the provision of mental health services.
You're a research economist at UMass. People might hear that title and think, well, how do these two areas line up? Mental health, the environment, and research economy.
Yeah, so it's a wonderful question that I get a lot. So basically, I'm applying statistical and research techniques that are developed in economics, which is how I was trained, to questions that are broader. So I'm really interested in health and other outcomes that are related to human well-being. This is not that different from thinking about things in terms of dollars and cents if our goal is really to think about how people are doing in a more general sense, not just how much they're earning or how much they're saving, but also kind of how they are. And so my research tends to be focused more on these outcomes that are related to health, related to kind of non-monetary measures.
The research was published in the Journal of Health Economics.
Yeah.
How do you hope that your findings will be used or applied?
I hope that when people are talking about climate change and the implications of climate change, both kind of at local and broader scales, that the impacts on mental health will enter the discussion. There's lots of discussion about the health effects, the likely impacts of flooding and extreme storms, but I think that this research provides evidence that there are other important dimensions that we need to be thinking about when we're both kind of envisioning a future world that's warmer or that's hotter, and when we're trying to plan for that.